Hello, my name is Nathan Wong, and I'm editor-in-chief of the new Cardiometabolic Disease Clinical Community, which is available on CardioSource. Today, I'm talking with Dr. Roger Blumenthal, professor of medicine and director of the Johns Hopkins Cicerone Preventive Cardiology Center, on the update to the prevention guidelines and what we might expect coming up in the near future. Welcome, Dr. Blumenthal.
Great, Nathan. Thank you very much, and welcome to the East Coast of the United States.
So for several years now, we've been anxiously awaiting the new prevention guidelines from the NHLBI, consisting of revised lipid and hypertension guidelines, as well as lifestyle risk assessment, and also an integrated guidelines. And recently, as we all know, the NHLBI announced that they would instead provide the work that has been done to this point to various societies, namely the ACC and the AHA, to consider releasing using their process that they've developed over the years. Can you tell us, Roger, a little bit about the process that has occurred thus far and what we should look forward to, and perhaps when?
Well, Nathan, as you well know, we had thought that 2 years ago we would have the guidelines out by then, and as a member of the AHA Planning Committee, along with yourself, we reserved prime time on Monday for discussion of those new guidelines 2 years ago. That hasn't happened, and it's been now more than 5 years that the committee has worked on things, and Dr. Gary Gibbons, head of the NHLBI, along with some of his senior colleagues, decided that the NHLBI did not want to stay in the guideline issuing business. So they had commissioned all this work that Dr. Betsy Nabel had organized about 6 years ago, and they decided to approach AHA and the ACC Foundation to take their well-thought-out review of the literature and to have AHA and ACC issue these guidelines. We're very hopeful now that AHA and ACC especially would like to have discussions about these types of new guidelines out by the time of their scientific meetings, and the Obesity Society has their meeting, I think, in December, that puts some time pressure on these other groups, and maybe we're hopeful that before the end of the year, 1, 2, or 3 of the new guidelines will actually be issued. So it's taken much longer than it should. You're in Washington right now, Nathan. We have to be politically correct, but hopefully there'll be people from the guideline committees will be able to write something that will explain what they've learned, what went wrong, because clearly this shouldn't have taken 5+ years to do.
So realizing that the actually joint development of these guidelines by the ACC and AHA in the past has sometimes taken quite some time, is a process going to be any perhaps different now that it'll be streamlined? So you really think there'll be something released as soon as this November?
Well, Nathan, I'm no longer a betting man. I haven't been to Vegas for many years, but I would venture to say that since there's been declining attendance at AHA, there's certainly, over the last few years, there's certainly motivation for them to try to streamline this process. It's the people who run the NHLBI committees are also volunteers with the AHA. So I'm hopeful that at least some document will be on the website by the time of the AHA, whether that be the lipids or blood pressure guidelines, I really don't know. But I think there's certainly the motivation, which wasn't seen when the NHLBI was driving the process. Now that AHA and ACC are driving the process, I think both societies would welcome the opportunity to get more attention for their meetings by having presentation of the proposed guidelines and good discussion. And like all guidelines, it's not going to satisfy everybody. There'll be people who will think the approach used could have been modified. I truly believe that it'll be a major step forward, and it'll be a very useful set of documents for all the clinicians.
Now, certainly the impact of these guidelines can be perhaps even greater if other stakeholder societies, such as the National Lipid Association for the lipid guidelines and the American Society for Hypertension for the hypertension guidelines, would be involved. And what is your understanding of how these groups might be involved, and and to what extent?
Well, the way I see the process, if indeed there's the motivation to get things done by the end of this calendar year, I don't foresee these other specialist societies having much involvement other than having them have the opportunity to endorse the guidelines. I presume, since the Institute of Medicine wanted, quote, more evidence-based guidelines, that whatever is issued in the lipid realm and the blood pressure realm will include suggestions for future studies where we don't have randomized controlled trials to answer the questions. So one of the concerns that have been expressed by the National Heart, Lung, and Blood Institute is whether especially societies might take a more aggressive tack in trying to make recommendations than is truly supported by the evidence if you just rely on randomized controlled trials. And that's one of the key issues, and what the real definition of evidence-based medicine is, Nathan. You and I have worked a lot on the MESA study, but that's not a randomized controlled trial. And the Institute of Medicine suggestions have been interpreted by some as that you have to just rely on randomized controlled trials. I think that's a mistake, because we, especially in the blood pressure realm, we haven't had many blood pressure randomized controlled trials in the last 15 years. You could make the case that in the lipid realm, we have enough randomized controlled trials. And just recently, your friend Peter Wilson co-wrote a piece with Paul Ridker that's published in the current issue of JAMA, which says that we should just simply rely on the eligibility criteria for the randomized controlled trials and not base things solely on their Framingham risk or projected risk by a modified Framingham score. So I'm sure there'll be lots of different opinions when the guidelines come out. Hopefully they'll be out within the next 3 months, but if track record plays a role, it certainly could be maybe the scientific session to the ACC. So you and I have a vested interest, since the American Society of Preventive Cardiology wants to focus in on these guidelines and to educate clinicians. So hopefully we'll get them sooner rather than later.
Well, thank you so much, Roger, for sharing with us your insights on these anxiously awaited guidelines. I guess maybe we shouldn't hold our breath as hard as we might, but we hope that they will all be out soon. And I also thank all of you for actually visiting our new community on cardiometabolic diseases. Again, this is Nathan Wong for the CardioSource Clinical Community on Cardiometabolic Disease.